From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Hello and welcome to Medical Forum. This week we have Reliable Medical on. We'll be talking about durable medical equipment this week. And I'd like to send this over to Jeff Reed, the owner of Reliable Medical, and Martha Joe, the general manager of Reliable Medical.
Great. Thank you, Chris. Hey, I enjoyed the show last week. Oh, Clay Ladder's a pretty good cut-up, isn't he? Huh?
Yeah, he had a lot to say about medicine and is passionate about medicine and brings a lot to the table.
He does, you and your entire company. But thanks for having us on. Reliable Medical Equipment, for those of you who don't know, we're located on 246 Broad Street. Been around since 1998. Merle Smith and I have been partners in that business for quite some time. You guys are a great liaison for us, as Toomey Hospital and the rest of the physicians here in town. Our contact information, if anyone is listening, is 934-9212. Just some quick things that we'll talk about today is all the things that we do at Reliable. And we're a little bit different than other just durable medical equipment, as you alluded to. We do durable medical equipment, which is a wheelchair, your walker, your bedside commode, and such. But we also do prosthetics and orthotics, diabetic shoes, a full line of respiratory, which today I'm very thankful and happy to introduce some of our staff later on into the show so you can get more acquainted with them. A couple things about us that I want to point out while we're talking about Reliable. Again, not only 246 right there on Broad Street, right in between you and Clay at Colonial, but back in August, we also opened up a new location down in Manning, right there on 37 Wrigley Street, 435-9927. So 2 locations. Thank you for having us on this show. And the first thing I want to do is introduce my general manager. And I will let her talk a little bit about herself. Martha Joe Johnson's been with us since 2009. She's a Sumterite. And Martha Joe, thank you for coming on the show.
Glad to be here.
Well, good. Tell everyone a little bit about yourself, kind of what your role is, and how you got talked into this this business of ours that we call Reliable.
Sure. I was born and raised in Sumter. Have been here all my life. I went to Converse College in Spartanburg after high school. From there, I went to USC Law School. I came back to Sumter for a year and worked with a judge here. Then went back up to Spartanburg and worked for the solicitor's office there. Interestingly enough, my husband and I at that point decided it's time to move back to Sumter, wanted to be with family. Some job opportunities came open, and Merle and Jeff approached me about coming to Reliable Medical Equipment. At that time, Medicare rules were changing. It became increasingly important to understand the rules, make sure that we were complying with them, make sure that we had a good handle on what we needed to do for patients and for the business. Merle and Jeff were both very involved in other businesses, and that's where I came in. So it's been an interesting experience. It has been. I've used more of my law degree than I ever thought that I'd have to use, but I feel we do a really good job at making sure that we're keeping up with the changes, making sure we're letting patients know about the changes, making sure we're keeping doctors informed, hospitals informed. But my first question when I came in is, what in the world is DME? I'd never heard of durable medical equipment. I didn't know anything about it. So a lot of people probably have that question. We do home medical equipment. It's anything that you need in your home to make your life more comfortable, depending on your medical conditions. Right. And as Jeff said, that could be a hospital bed. That could be oxygen. That could be a wheelchair. We're unique in that we do orthotics and prosthetics as well, which are bracing and artificial limbs. So we do a vast array of equipment. We have specialized personnel to deal with each of those.
Well, I think that's the great point that we want to emphasize. Mm-hmm. It's certainly a smaller branch of a Colonial family practice, and the mentality of what you guys have done, Chris, is we've said, how can we help the patient from start to finish? So from nebulizers for your children to oxygen to wheelchairs to artificial limbs, as Martha just said, is something that I think is a a commodity that we will talk about and later on in the show, but to bring them all under one roof, it allows us to get the same paperwork, and we get to have a patient, as you know how vital that is. We're able to take a patient and be able to have one contact person that they can then get many services.
Medicine's an evolving field. Convenience is so important for patients, including customer service, one of the things we strive for at Colonial Family Practice. And again, patients really like to have as many resources under one roof as possible. And Reliable offers that. Patients, again, they can get multiple different durable medical types of equipment, oxygen, and prosthetics. Again, very few facilities are doing that. Very few businesses are doing that and doing it well. And Reliable does it well.
Well, thank you very much. And when we meet some of my staff today, I think you'll see that they actually are not just the nuts and bolts behind it. They're very educated. They're articulate. They care about the patient. And they're, as Martha Jo talked about with certifications and such, that they're very knowledgeable in their field. So what I like about what we bring in is that not only do we bring the services in, each one of those individuals have been trained specifically in what they bring to the table. And you know, Martha Jo, we talk about Reliable and you coming in with your law degree, which we kind of laughed about. Wow, she's overqualified by being a lawyer. But as we've seen with all the Medicare changes and things, it's almost essential. I don't know how we would have done it without you. So maybe some of the questions that I might try to bring to you, and then we're going to have Aubrey Brunson, our operation manager, also come in later today. But a question to you is, what do you two, speaking for her as well, what's a question that comes up when people come into our office? What's a question that people talk to you about or ask you that maybe rings a bell first and foremost?
Probably one of the most common questions we get is, does insurance cover this item? Insurance pay for this? Do I need to pay for it out of pocket? And that is not an easy question to answer a lot of times. It depends on what the patient's insurance is. It depends on the type of equipment. And there are different rules and regulations that apply every time. We try to work closely with doctors' offices and referral sources to make sure that we're getting that right documentation. So it's a fine balance of trying to help the patients as quickly and efficiently as possible, but also making sure that we're following the guidelines and documentation requirements so that the patients don't have any unnecessary financial responsibility.
And we'll come back to this after the first break, but do me one favor here and remind the people listening in again, Reliable Medical Equipment. Where are we located? Give us our 2 locations and a phone number and how we can reach.
We're in Sumter. We're at 246 Broad Street. That's right across from the Firestone. Our phone number is 803-934-9212. And Manning, we're at 37 West Rigby Street.
Right.
Jeff, if you have that phone
Absolutely. Number. It's 803-435-9927. And we're there 5 days a week from 8 o'clock till 5 o'clock. Sometimes we work overtime. So after our next break, we'll come back and we will have more talk with Reliable Medical Equipment and Martha Jo Johnson. Thank you.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
Owning a firearm is both a right and responsibility, and keeping your firearms out of the hands of criminals is a special concern. Last year, 38 guns were stolen from cars and homes in the city of Sumner. This is Joey Duggan reminding you to do your part as responsible gun owners. Help keep firearms out of the hands of criminals. Locking your vehicles in storage compartments if leaving a gun in your car, never leaving firearms in your vehicle overnight, and storing all firearms securely in your home. For additional information on firearm safety, contact the Sumner Police Department's Crime Prevention Unit at 436-2723.
As a referee, I pay attention for a living.
While I'm busy watching the game, I need your help keeping an eye on the stands.
If you see something that doesn't look quite right, tell a law enforcement official.
We all play an important role in protecting our communities, and you can help.
If you see something suspicious, say something to local authorities.
If you see something, say something is used with permission by the New York Metropolitan Transportation Authority.
This is Medical Forum, presented by At Your Service Home Care.
Hi, we're back with Medical Forum, brought to you by At Your Service Home Care, your concierge, steward, guide to home care and beyond. We're located at 1250 Wilson Hall Road. Phone number is 803-607-9677. Our website, www.ays-homecare.com. We're back this week speaking with Jeff Reed and his team over at Reliable Medical. And before the break, we were talking about some of the services over at Reliable Medical.
Yes, thank you. Reliable Medical, as we were talking about as we went to break, how proud of the services that we bring in. And we've added these services as we've developed back from 1998 to where we are now at this day. But Martha Joe, a question I think that people want to know: tell us, how many people work there? Who is certified? What assets do they bring to the table? And maybe we can also talk about walking this through a patient from the time the phone call comes in. So if you could answer that first question, how many staff?
Sure. We have 14 full-time staff members. On staff, we also have 2 certified prosthetist orthotists. We have 3 respiratory therapists on staff, and we also have 1 certified orthotic fitter. So we're not an extremely large company, but we're by no means a small operation either. We have everybody qualified in their particular areas. Our certified prosthetist and orthotist can't answer a question about oxygen, but our respiratory therapist, they're all fully trained and qualified in their areas.
Well, great. I want you, if you would do me the pleasure, to introduce the young lady to your right and introduce her, give us a little background from your standpoint. And then, Aubrey, we would like to hear from you a little bit today from our operational standpoint. So, Martha Joe, if you would.
Sure. We have with us Aubrey Brunson. Aubrey handles, she is our operations manager. She oversees everything at Reliable, was there well before I was.
She's a legend is what she is.
She is.
Let's call spade a spade.
She knows a lot of answers to a lot of questions, or as we say sometimes, she knows it all. So this is Aubrey Brunson. She can walk you through basically if you need a piece of equipment, what happens when you call our phone number and where you go from there.
And let me give one more plug on Aubrey and I have known each other for about 10 years, and she's worked with us for 10 years. And Aubrey started from when she was in school filing papers to now, I'm proud to say, our operation manager. And I get compliments probably on Aubrey from social workers, physicians like Dr. Mara and such, as much as anyone, because she actually cares about the patient first. And Aubrey, I thank you for that. Aubrey, if you can elaborate, tell us, Dr. Marks calls on the phone or has one of his staff calls. What happens and how does Reliable Medical take care of that patient at that point?
Well, Jeff, with everything that goes on at Reliable, obviously we carry a lot of different types of equipment. So depending on what it is, the roundabout way is when we get a prescription, we make sure that everything is on the prescription that is, to where we are following all the guidelines that we are supposed to be. Once we get all of that taken care of, it goes through our customer service department, like if someone was to call in, and we give it to our insurance specialist, and we make sure that we have all the documentation. We make sure it's covered by your insurance, and once we get you your equipment, then it goes back into the billing process, and we make sure that we verify all the stuff with the insurance again. And
well, let's back up one second if I can. So the phone call comes in, and we have four, I think, of the four best CSRs in town. Customer service rep. Do you agree with that?
I do agree with that.
They're fantastic. All right. So now the phone call has come in. Our CSRs get it, and we have our insurance specialist. It then takes care, and I think that's vital not only for our protection because we want to look for it, but we're really looking out for the patient as well, which I think is very
Definitely.
nice. We will let them know if they're still eligible or if they have a deductible or we need more documentation. And so now talk about our delivery guys.
We have 2 to 3. We have 2 full-time delivery guys. We have one.
Right.
They are wonderful. They are great to deal with.
100% of the time?
I mean,
Of course, you guys always get along.
They are.
Right.
They are wonderful. They go the extra mile for the patient, making sure that, even if it is after 5 after we close, we are there 24/7. We have on-call service. If anything was ever go wrong, like an emergency or something with someone's oxygen, we are there for them no matter what. They are trained to go over all the paperwork and the documentation that goes along with all that, and they are trained to explain the equipment, and explain how it works, and they make sure that it is going to work for that patient, and they make sure that the home is safe for that equipment, and
that's great.
Just go through everything with the patient.
So now the equipment's been delivered.
Mm-hmm.
And then the next part is we have to bill it. And that's one thing that I think we want to emphasize to all the people out there. We handle the billing for you. And not only do we handle the billing for you, we are in the same location. Our billing department is not in China. Our billing department is not somewhere off campus. So the same number, the 9349212 number that you call, you not only can talk to Aubrey, you can not only talk to Martha Joe or one of our wonderful CSR people, you can talk to the biller. Is that correct?
That is correct. Everyone if you ever come into Reliable, anyone that you see in there, if you call our phone number, you are going to be able to talk to one of those people. You will not have to worry about being transferred to another state, or if there's a bill, you call this number. Everything is handled with that phone number that is on all of our paperwork, all of our stickers on the equipment, everything. So it's all in-house, and we're all locally Sumter residents and all that. So it's a wonderful thing to have everything in-house.
And that's great. And Dr. Marr, now, and you can be as honest as you want on here, but we've dealt with each other for quite some time in Colonial Family Practice, and we appreciate all the business that Colonial and surrounding areas. How can we help you more? What do we do to help you out as a physician?
Well, the better service that we refer to, the less work we have ourselves. I've been referring business to Reliable long before I knew who was running the show because of the good service. There is a movement, and a lot of patients will find that they're being advertised medical equipment. They can be sent the medical equipment through the mail, and it's an important point, and I get these forms all the time for knee braces and back braces and oxygen, but having someone local to properly fit them, properly bill them, and to make sure that the paperwork is done appropriately is such a great service to the patient. The patients are going to have less financial problems with billing because it was done correctly, and if there is a billing concern, everything is local.
Thank you, Dr. Marr, and I appreciate you saying that. And that It's so much a reflection on our staff, and when we come back, we will also meet more staff members from Reliable. So we'll be back right after this break. Thank you.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment. For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in-home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
We're back with Medical Forum, brought to you by At Your Service Home Care, your concierge, steward, guide to home care and beyond. We're located at 1250 Wilson Hall Road. The number over there is 803-607-9677. We're here talking this week with Reliable Medical, Jeff and his team. We were talking in the last segment about being local and how important it is for his team to be local, and that includes dispensing the equipment and fitting equipment, taking care of patients right here in Sumter. They do everything from dispensing the equipment to taking care of the bills for you. One of the marks of any medical business is accreditation, and it's very important to make sure for myself that I'm referring to an accredited business. And if you guys could just tell me a little bit about what's involved in your component of the accreditation process.
Sure, I'll be happy to handle that. What we are accredited by actually two different agencies. We're accredited by one first called HQAA. They are a DME accreditation agency. Basically, what that means is you have you go through a process with the accreditation agency. They have certain standards and policies and procedures. They make sure that you are abiding by those standards, you're fulfilling them. We have site visits every 3 years from them to look at our facility, assess the competency of our staff, and interestingly, they really help us make sure that we're doing the best that we can, and it puts everybody on a playing field. So you make sure that you're dealing with a company that holds themselves to a higher standard. But we are unique in the fact that we also are accredited by a second accreditation agency that is called ABC. They accredit us for our orthotics and our prosthetics. So they look at the clinical end with our orthotists and prosthetists and look at how we handle our patients, the equipment you're using, and hold us to higher standards as well. So we're very proud of our accreditation status with both of those companies, and we've been renewed 3 times now. Just went through our last renewal. So very excited to brag on that.
Well, what a great segue to our next guest. Again, we talked about prosthetics and orthotics, and that is a very, very large business of what Reliable Medical does and treats people. And that's anything from a prosthetic limb to a custom orthotic. If your son has a knee problem, from a torn ACL to a geriatric brace and to diabetic shoes. And we're fortunate. We have 2 what are called CPOs, and we will get into what that stands for, Certified Prosthetics and Orthotics. And one that I've worked with for 15 years now, Wynn Gasperson, has been part of the team, as I said, for 15 years, and couldn't be more proud of him. Now, Richard Barkley, our other, is out seeing patients today. So, Richard, we miss having him in here, but there will be a later show when you and Richard can talk. But, Wynn, thank you for coming today.
Thank you for having me, Jeff.
Give us a little background on A, yourself personally, and B, tell us what a prosthetist is. What's this CPO?
So a certified prosthetist orthotist is somebody who has been certified to meet the standards of the American Board for Certification in Orthotics and Prosthetics, which is also one of our credentialing bodies. It's also a professional credentialing body as well. So a prosthetist is somebody who makes anything that replaces a part of the body. So an artificial limb or an artificial leg, an artificial arm. We also do finger prostheses, and we also...
Well, even foot. I mean, when someone has a toe amputation, then, we look at filling the toes, even in for balance, correct?
Correct. And as far as orthotics is anything that braces the body. So any part of the body that needs to be supported or limit some motion, like a spinal orthosis or an ankle-foot orthosis or a leg brace. That's what an orthotist does.
Well, and what's interesting is that you hold both disciplines, and there's some people that are trained exclusively in each, but you have for over 15 years. And tell us about your education background a little bit. Up in Northwestern, eh?
That's where I went to graduate school. I started off in undergrad at Ohio University and received a bachelor's degree in biomedical mechanical engineering, and then went on to graduate school to do both programs, orthotics.
Gotcha. Now, for people listening in, number one, last week on our show, we had Colonial Family Practice, and one of the topics we talked about quite a bit was diabetes. And if we center our focus today's discussion just on prosthetic limbs, artificial limbs, one, being in the business now for 15 years, it astonishes me how many people actually have, unfortunately, had an amputation. And us being in South Carolina, diabetes runs rampant, and this is something that we see, particularly in our geriatric patients, losing a limb. Talk me through, a surgeon has diagnosed the patient for what causes me to have my leg cut off?
So diabetes is a systemic disease, and it runs havoc with the circulatory system. So you'll lose a limb typically due to infection that the body can't fight off as a result of the lack of circulation to that part of the body.
Well, and I know that a lot of our patients, we'll say this, predominantly most of our patients are what we call below knee amputation, and then there's above knee. What we want to convey to people, and I'd like for you to elaborate on that, it's a very, very serious problem and when people lose a limb. I mean, when you have a part of your body removed. But let people know out there, this is not the end of the world. I've seen some of the happiest patients that we've had that have fought to keep that leg and had their toes cut off and such. But once you fit that prosthesis with the technology that is now available here in Sumter, and you say you don't need to go to Charlotte, you don't need to go to Columbia. We have all that technology. Tell us some of the if I was a prosthetic patient, tell me what's going to happen to me after that leg is gone. Where do we come in? Where does the surgeon, what happens?
So the first thing that's going to happen is it has to heal. And during that process, we can start the shaping of the limb. which is dependent on the surgeon as to what they see in the operating room, whether or not they want to do that. And then once they heal, then we'll start the fitting process. And we'll put a shrinker on their leg to help shape it because it'll be swollen from the surgery process. And then we'll put what we call a socket on them. And that is what they'll bear weight through. And then we put a foot on them, and depending on what level of ability that they have, we'll go as technical as we can. We fit feet here that are the same technology that was used for the Olympic runner in the 2012 Olympics.
Right.
We also use microprocessor-controlled knees. So these are knees that analyze what's happening at the foot, what's happening at the knee, what's happening at the socket, and offer a patient stability and a more natural-looking gait.
Well, when we come back from our next station break, I'd like to keep you on for a half a segment if I can, but I want you to talk to me about some of the technology that's out there, not only from the foot standpoint, but the way we measure those legs, and we'll be right back.
Glad to do it.
Thank you.
Back with more on Medical Forum, presented by At Your Service Home Care.
For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
We're back with Medical Forum, brought to you by At Your Service Home Care, your concierge, steward, guide to home care and beyond. We're located on 1250 Wilson Hall Road. The number's 803-607-9677. We're here again today with Reliable Medical. Jeff and his team are talking about their services. And before the break, we were talking about the technology it goes into properly fitting, and for prosthetic devices, and how important that is.
It's very important. Product selection and component selection is one of the key things that we do when we interact with patients. As a matter of fact, we probably spend more on our patients than anybody else in South Carolina, just because we don't let the bottom line affect the components we use. So we're more likely to choose a better product and spend a little bit more even though we're going to get paid the same for it. In addition to that, we talked about the Olympian who ran in the Olympics in 2012. There was a lot of debate on whether or not he should be there because he was having a mechanical advantage with the prosthetic feet that he was wearing. And that's really a joke, because the feet that we normally walk on every day return anywhere from 250 to 300% the energy return. And the best we can do with prosthetic feet is about 100%. And we do a lot of those feet because they're not only are they good for the young athletic amputee, but they're also good for the elderly amputee as well, as because they're more efficient. And the energy demands of walking take a greater toll on the geriatric patient. So it's important that we return as much of that energy as we can back to them and give them a more anatomical looking gait or natural looking gait.
Well, when another thing that I like about what we do here, there are a lot of changes in a body. And I think as the person has the amputation, it seems like they either lose weight or gain weight. They don't stay the same size, which it's so important to have a local provider. Generally, in a prosthetic patient that we fit, we see them maybe 4 or 5 times before we get the final fitting between, as you mentioned, the shrinker. But let's just start from the beginning. We introduce ourselves to them and we educate them on what the process will be. We usually fit them with a shrinker, which is just a little sock that helps, the healing process, shape the leg,
and
the healing
encourage
process.
the healing process. Absolutely.
But once we fit the limb, our job's just started. Agree?
Oh yeah, absolutely. There's a whole lot more involved. We have a lot more patient contact. We have to evaluate the patient and see what is going to be the best components for them, whether they're an above the knee amputee or below the knee amputee. So we try and design each prosthesis to fit the needs of each patient. And
I think that's what we're trying to convey, the fact that my needs may change as I develop through the years. So we've had prosthetic patients for 15 years. They go back to work. They're out there in the community, and I think that's a credit to not only the craftsmanship that you and Richard do, but also the technology. And tell us a little bit about the CAD/CAM system that allows us the accuracy in which to develop the socket you talked about.
So impression technology for prosthetics has come a long way. Years ago, when I first started in this field, what we did was we took a cast of the patient's limb, created what we called a negative mold. We filled that with plaster and created a positive mold, and then we made the prosthesis from that. Now we're using digital technology. So we have a imaging system that uses magnets, and it's measures 3 points in space, and then we basically rub that across the limb and create a digital image, and then we can modify that and duplicate it. And if we have a patient who calls in and says, "Hey, I'm wearing 10 plies of socks," then we can make a check socket from that old interface, and they don't even have to come into the office.
Well, see, I think that's what's nice. I know Richard has patients all the time that like the old cast situation, but we can take that cast and then we can still use the CAD/CAM, which allows us accuracy, and it also allows us then time frame, turnaround. How quickly can we get the limb back for them?
When we utilize overnight shipping and things like that, then we can have a 3-day turnaround.
Well, while we're talking about prosthetics, let's just keep on that side. People want to know, well, how does this thing stay on my leg? How do I keep this thing on my leg? Tell us about a couple of what we call suspension systems that enable that leg to safely stay on.
So there are 3 parts of the prosthesis, basically the below-the-knee prosthesis. That's the foot, the socket, and then the suspension. And so there's lots of different suspensions, but the newest one is a positive locking system. So it does not come off until you want it to come off. And that's probably the latest, and it's about 20 years old now, but the latest technologically advancement to the field that has really enabled people to function at a higher level. Because it used to be you were worried about keeping your prosthesis on.
Right. Right. And just to give a visual, that your limb has been amputated from the knee down. There's a sleeve, and it's a very comfortable silicone sleeve that comes on your leg that you would roll on, and sticking out of it is a screw. And it goes into the limb that Hwin has made for you and prepared for you, and has a locking mechanism that attaches it. And what's nice about it makes a nice click. So if you're questioning, am I in, am I not? Click, 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 and we're in.
And then to take the prosthesis off, you press a button and push it off, and it slides off.
Well, and here's the other part. When we understand a lot of prosthetic patients, they have so many doctor's appointments, and some are on dialysis and such. I think a great service that you guys do is to go to the home.
Well, and going to the home is a big part of what we do. I think it enables us to look at the patient and see them in their own environment. Then we can make a better recommendation as to what their needs are. And we're able to see them in their own environment, walking and doing the things that they want to do, what we call their activities of daily living.
Well, in addition, I know very frequently we meet with the physician to go over that needs too, so they can see the development of the patient. And again, I know we've talked, and we're coming towards the end of this segment, so Hwin, thank you for sharing this with us, and we'll do it again. But what we want to emphasize to people, one, it is covered by insurance. Two, you are eligible to get a new socket replacement, at least to where it can fit when, as you've mentioned about the plies, the 10 ply sockets, if the limb is too tight to where you can't get in it or it's too big. So it is something covered by the insurance. Call our number, 934-9212. We can answer all those questions for you, whether you're above knee, below knee, bilateral, which means we've lost both limbs. That's not the end of the world. We can still get up and going. Is that right?
It is correct. And we see a lot of different patients from all walks of life. We've got a umpire, we've got business people, we've got grandmothers.
Hwin, thank you so much. And we'll be back with our last segment of Medical Forum right after this. Thank you.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment. For some, in-home assistance is temporary while recovering from surgery, injury, or welcoming a new family arrival. For others, however, it's the beginning of a new path. It's often an overwhelming path of confusion, gaps in service, and questions when a family finds out Medicare doesn't pay for extended nursing home, assisted living, or in-home care. At Your Service Home Care is owned by Sumter Physicians and medical equipment providers. They have combined their expertise in healthcare and medical equipment together with specialists in the fields of in-home care, home health and hospice support, insurance, and attorneys. This team stands as the link between what a family needs and how to find resources to make it happen. At Your Service Home Care has the knowledge to provide in-home care and beyond. But it's much more than a sitting service. It's the one call for a family to have concierge service, steward, and guide to create and implement a game plan for the care of a loved one right now and for the days ahead. To discover your path to the finest in-home health care, call At Your Service today at 803-607-9677 or visit them at 1250 Wilson Hall Road today. Find them online at www.ays-homecare.com.
This is Medical Forum, presented by At Your Service Home Care.
Hey, welcome back to our last segment on Medical Forum, brought to you by AYS. at your home service. The Guide, Stewart Concierge for all the home care on 1250 Wilson Hall Road. Phone number there, 803-607-9677. Give them a call, and they'll guide you to home care. Back with Reliable Medical Equipment. And our last segment, we want to talk about a very, very important part of our business and introduce you to a respiratory therapist. It's been with us since the beginning of time. Jennifer and I go way back. But we're going to talk about our respiratory department. And Aubrey, thank you for rejoining us.
Always.
Thank you. All right, Jennifer Disher is with us today. Jennifer, you and I have worked together for, 15 years?
Aubrey says 17.
Has it been 17?
Since it opened,
Since day one.
since the time. You just said that, since everything
I thought I was
started.
playing tennis then.
Since dinosaurs were around.
Yeah,
I
since
don't know.
dinosaurs. Anyway, Jennifer, do this. Give us a little background, couple little minutes on your education background, what you've been doing. You're a Sumterite.
No, I'm a maniac.
A maniac.
I'm
Okay,
a
well, tell me
maniac.
about that.
Military brat. Moved to Sumter. Went to school. Joined Toomey Hospital in 1980 as OJT. Did first year of school through correspondence back in the day of dinosaurs when you could do respiratory therapy through correspondence school.
Right.
Worked probably 15 years and then decided I want my second year of school and did it through Greenville Tech. And
Yes.
became an RRT, and I've been at Toomey 33 years, and I've been with you 17.
Great. See, I think a Sumterite, 1980 qualifies you as a Sumterite, but I'll give you that.
Okay.
See, I've been here since 89, and I consider myself a Sumterite now. Aubrey, you weren't even born hardly, and
I
then
was born in 89.
Okay. All right. Let's talk about oxygen, and let's talk about respiratory, and let's talk about CPAP and what people associate with, because that's a huge department of reliable medical equipment, and sometimes people forget about that because of some of the services we do, but we're super proud of our oxygen, our CPAP, our BiPAP. So, Jennifer, let's talk a little bit about the CPAP. That's a very popular item that we have. What is it? Who qualifies for it? And what symptoms should we look out for to see if maybe we need to see our doctor about?
CPAP is a continuous positive airway pressure. Is used for the sleep apnea. If you've got a partner or spouse in the house that's hollering, you're snoring, you're rattling the windows,
Okay.
you might need to tell your doctor. Most of the times the partner does tell the physician, I can't sleep because they're snoring, I'm leaving the bedroom. If you get up tired every morning, been up a couple hours, you need to go back to bed. Excessive morning headaches, those are all signs and symptoms that you could have the sleep apnea.
Now, if I'm seeing my regular physician, is this something that you find most physicians handle themselves, or do they usually then refer you to, say, a cardiopulmonologist? What happens from this point?
It used to be strictly your primary would send you to the pulmonary doctor, but now a lot of the physicians are doing the ordering themselves to
Okay.
the different sleep labs in town, who then in turn send the order back to the primary physician once somebody who's qualified has read it, interpreted it, for us to do the machine or for the patient to get an order to have a machine.
Right, so a sleep lab. Do I just go to sleep, or talk me through that? So I go and see the physician. I've got the snoring going on. I'm walking half asleep through the day. I feel like I meet the symptoms. My physician recommends me. What's a sleep lab? What happens?
A sleep lab is where you go and spend the night. You're attached to 250 million wires so they can watch your body, every movement, every gasp, whether you're breathing, your oxygen level during the night. And they want to see if you're having gasping, snoring, and what your oxygen level does. Because if your oxygen level starts dropping, then we've got a bigger problem going on that we need to treat to keep everything in check during the night so your body's happy.
All right, so Aubrey, I've gone in, I've been referred, I do the sleep study, you get the readings back, and
With the order. Mm-hmm.
Now what happens when I come to Reliable Medical Equipment?
We contact you to let you know that it has come to us and that we can either go ahead and make you an appointment because we have already verified the insurance, or if we need to go ahead and start the authorization process, we'll go ahead and do that. And once that process is done, we'll give you a call and schedule you an appointment to see one of the respiratory therapists. And you come in and they go over everything with you. They go over the machine. They fit you for your mask. They talk to you and get to know you and see what kind of, nose, if you breathe through your nose all the time or through your mouth.
So there's a lot of different masks and supplies. So this
lots of different.
So our decision making in our examination standpoint starts at this point once we get in. And one of the things that I found with CPAPs is that sometimes we may go home with one particular mask, and then we come back a week later and say, I need something changed, or I need a bigger mask, or I need a different mask. Do you find that?
It happens very often. Every patient is different, so every patient isn't going to like this mask what the other two patients did like. Everyone's different. Everybody's face is different. And
all right, let's talk about Reliable Medical Equipment a little bit. I'm a patient of yours, and now I become a CPAP patient of yours. And we've talked about going to a specialist. We've talked about going to sleep labs. How do I ensure that Reliable Medical is where I'm sent? Do I need to notify the
You let your doctor know.
It's your choice, right?
You can choose wherever you want to go. You can tell them that you do want to use Reliable Medical. And once you tell your doctor that, they should send everything to that company you chose.
There you go. Well, no, I think,
or if
Jennifer,
you got a phone call from a company and it was not who you wanted, you simply call your physician and say, no, I don't want them. I want this company, A, B, or C. It is totally the patient choice. It's not a one-stop shop. It's not one size fits all.
Well, that's great. Hey, while we're at it, let's talk about the as important, and we're going to have to be brief with this, but oxygen. Aubrey, talk people through as quickly as you can. I've only got about 90 seconds left, but what qualifies me for oxygen? Do I still have to see a specialist? Is this something that we see from family practitioners? Tell the listening audience what oxygen in the criterion that we need.
Any doctor can write for oxygen. Depending on what your SAT level is how you qualify for it. If you ever have where you're walking around and you're short of breath, you do need to talk to your doctor about that, because they can, test you in the office, doing a 6-minute walk to see if your oxygen level does go down into the 80s when it's not supposed to, and that's how you can start the qualification for the oxygen, and that's how we can start seeing what we need to do as a company to get you the oxygen that you'll need.
And the magic number is, 88, 89?
88%.
So if your physician tells you, once I did that 6-minute test with you, that you were at 88%, then oxygen is something that you're going to need to look at.
Right.
Y'all, I appreciate you coming by today. You've given us a lot of information. Y'all, the best staff I've ever had. I can't thank you enough. Martha Joe, thank you for stopping by and educating us, not only on your background, but keeping Reliable Medical nice and stable. And Dr. Marr, who just stepped out. We want to thank him. Y'all, next week, please join the show. And real quick, show's airing here at 10 to 11 on Saturday. We'll re-air from 2 to 3 on Sunday. Next week, we're going to talk about hospice on Medical Forum. Thank y'all.
You.